for joining us today on the Dr. Mike and Shannon Show. I'm medical technology specialist Shannon Panenstein, representing Mazan Medical and our Urival BRS screening device for sacral nerve dysfunction. And I'm joined by Dr. Mike Bradley.
Hello, hello.
And Dr. Mike, go ahead and tell us briefly about yourself for those of you who are new joining us.
So I'm Mike Bradley. I'm a PhD. I work in medical research, specifically in pelvic floor health. I help a lot of women here in Las Vegas at several locations be able to find continence. I work with a lot of men for the same problem as well in a different state. And excited to talk about what we're going to talk about today.
And today we are going to talk about, if you watched our video, and if you haven't, I'm going to recommend you go back and watch our YouTube video of why French women don't pee themselves when they laugh, and you do. And we had talked briefly about what kinds of questions you as a provider could be asking your patients to be able to know if they would qualify for the screening, and should, what kind of, procedures and what you would recommend to be able to help with incontinence issues, sexual dysfunction, or if you're a patient, things to be able to ask your providers. So Dr. Mike, you do this in your office. Go ahead and tell us about what you do and what types of questions that you're asking your patients.
So generally we have and every patient has been able to fill out like that initial, group of forms that they do. And a lot of times we're asking a general assessment about that patient's overall health and well-being. And one of the things that we like to assess in our particular, OBGYN setting is how is the bladder functioning, and how is bladder affecting their personal lives? So one of the questions that we always ask is, kind of a bladder questionnaire. This is common in your, nursing homes. It's like required in nursing home settings, assisted living facility settings. OBGYNs that are doing, those annuals that you guys have to do every year. And really it should be a part of general health, beyond just OBGYNs. I think, regular medical practitioners should do it as well, where we're asking some real basic questions to determine if your quality of life is being affected based on your bladder, which a lot of times it is. And a lot of times those questions aren't asked. A lot of times the questions aren't thought about by the person who's coming in for their annual. They just want to make sure that their pap smear or whatever is clear, those kind of things. But I think it's worthy of at least a look at. So I thought today would be fun for us to go through some of those questions that we had asked at that initial visit, and what we kind of do based on the answer to those questions.
And this is great because I know a lot of people, they go in for their annual visit, me included, and we hear all the common things, that are told to us on, commercials, society. Oh, you're just getting older, or, oh, you had a baby. And these are just normal things. And so they're not really things that you think to ask or to even bring up and have the conversation about, because you do think it's normal and it's not. So this is a great way for you to be able to talk to your provider. And if you're a provider, we can also provide you, you can go to our link in the discussion and we can get you the list of the questions that Dr. Mike at UNLV Medical Center, that he does with his patients, to be able to also determine if the screening should be done.
Yep. And this is to be able to determine, of course, the bulbar cavernosa reflex test that we talk about so many times. But it also directs us to where, if the patient may need some pelvic floor rehabilitation to be able to kind of improve their overall quality of life. So there's two questionnaires that we do. One is a basic questionnaire that we do on every patient's annual visit. And then there's another one we do when we're doing a clinical study, where we're really kind of diving into the direct changes that would affect a person's quality of life. But for this purpose and for this video, we're going to talk specifically about the basic one, the one you do at your yearly annual. And so the first question that we ask is, do you lose urine? Do you leak urine, even a small drop? Wet yourself, wet your pad, your undergarments, when you cough or sneeze. And then we go on to ask, do you do this some of the time, rarely, once in a while, often, most of the time, or all of the time? And so what we're asking there is, when you sneeze or you cough, especially when you're sick, do you lose urine, right? And a lot of times when we're sick, what we're looking at right there is a version of what we call stress incontinence. That would be the diagnosis of that, is stress incontinence. That a stressor is causing our bladder to lose a little bit of urine, even a drop, but it's losing it a little bit. And what's interesting about that question is that usually when you're coughing or sneezing, you're also sick. So your body as a whole is weakened. And that's when we find these particular symptoms have a tendency to present themselves kind of before they become a real issue when you're sick, because your whole body is weakened and that pelvic floor is weakened just like the rest of your body because of whatever illness you might have.
That's really interesting. Especially during COVID time.
Yeah. Yeah.
Yeah, that's, you have all that stress going on already from COVID, and then you have this going on.
Yeah, the stress incontinence is a very interesting, and that leads us to kind of question two. It says, do you leak any of this urine, even a drop, when you bend down or lift something up? Or question number three, when you walk quickly or jog or exercise. A lot of women, it's almost a joke when they go to CrossFit or those kind of things. How many of them are soaking their pads at CrossFit or exercising or going to the gym? And it's funny to me, that is not only something that's fixable, it's something that we really should help people with, because they're hesitant to go to the gym because of what's going to happen when they go to try to work out. They can't
Yeah.
enjoy fitness anymore because of this urinary thing. So that's a direct reflection of how it affects your life with this incontinence problem, and it's all tied to stress incontinence. So
I could definitely see that being a problem, especially when you're in like a yoga or
yeah,
a Pilates where you're
yeah.
doing a lot of those core pelvic movements.
Yep. A lot of women, they tell me it's kind of a joke in their classes. It's a joke. And I talked about this before, where we make fun of this in our country, but it is a serious, I will say it's serious enough to to have the conversation with your medical professional on what you should do to be able to kind of help with this problem. Now, question number four is, while you're undressing in order to use the toilet. Now, that's an interesting question that we ask. A lot of women, when they are running to the bathroom and they're trying to get their pants down or their underwear down, that's when they start to lose the urine.
Mhm.
And that's a form of
You get in such a hurry and you're
yeah,
like, no.
yeah. Just quick, no, 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 please, please, please. One of those kind of things.
I'm right
And
here.
we call that urge or urge incontinence or urgency. That's what we refer to. That's a separate diagnosis. But a lot of women don't realize that that's a problem until they're running to the bathroom. I had a patient who told me that she would actually have a bucket in her garage, because something about when she pulled into her garage, she knew she was close to that bathroom, and she just couldn't make it. She simply could not make it to the bathroom. So
Oh,
she would have
that's
a bucket in her
interesting.
garage.
Yeah, I mean, as soon as I walk in the door, it doesn't matter, no matter what fails, it's like straight to the
Yeah,
bathroom.
yeah. And that urgency can be little, it can be a lot. It kind of depends on how, let's just say, how bad the pelvic situation is, the pelvic floor situation is. But it's definitely something worthy of talking to your medical professional with, your doctor with. And that's why we ask these questions, because it directly affects a part of everyday part of your life, right? So number five is, do you get such a strong and uncomfortable need to urinate that you leak urine, even a small amount, or wet yourself before reaching the toilet? Same concept, right? That sometimes maybe it doesn't have anything to do with dressing or undressing, but what I just talked about before, where you walk through the door and it hits you, right? That bathroom is right down the hall and it hits you. So we're all talking about, on question 4 and 5, urgency. So we've addressed stress incontinence issue. We've now addressed urgency with our questionnaire. And then we have this other question that we ask is, do you have to rush to the bathroom because you get a sudden or strong need to urinate? And that of course is that same line of questioning. Do you have urgency? Does urgency hit you? And if it does, can you even make it to the bathroom? Sometimes people can make it to the bathroom, but they know they have to run. It's one of those deals where, get out of my way, I need to find the bathroom. We kind
Right.
of joke a little bit when you're driving down the road. Um, is it the next bathroom, or is it the next clean bathroom? And
Yes.
get to decide that, right? So that's
I've
one
been
of the ways is, it's not about whether or not it's cleaner. And let's face it, cleanliness is important in that particular situation. It goes through our minds. If cleanliness doesn't matter, that means it is affecting your life.
Yeah, we'll take a porta potty, which is really bad.
Yeah, yeah. So, and then we move on to the next question, which is how many times do you urinate during the day or at night? And this gets into the question of something called frequency. It's not urgency. It's not stress related. It's like every 5 minutes you're going to the bathroom. Now, there can be a lot of reasons for this, but for the purposes of a weak pelvic floor, we look for nighttime frequency, getting up to go to the bathroom more than once.
Mhm.
We look for, are you going to the bathroom every hour? That could be a lot of things, including incomplete bladder emptying. The bladder isn't fully emptying. That usually ties to a lot of UTIs and chronic UTIs because the bladder is not fully emptying, and it also ties to frequency. And frequency is that next topic of conversation. Then we get into questions about, do you use an incontinence pad? It's so amazing to me that people will say, I don't have any of these problems at all, but they're using incontinence pads every
Yeah,
single day.
yeah.
We see it all the
And
time.
they're soaking them. Yeah.
Yeah, and they're soaking them, but I don't have any problems. I don't have any problems. A lot of times too, I think a lot of doctors out there really don't know what to do. They've got some ideas on things they can do, but there's not a lot of good pelvic floor programs in the United States. So I think a lot of doctors and physicians, if they don't have a fix for it, they kind of stray away from that a little bit. And I would encourage, those medical professionals that don't have a good program in place, maybe to reach out to us and maybe we can help them with that a little bit. And then we kind of go into the next part of it, which is the final two parts where we ask, do you have any leakage of stool? Because a lot of times urinary incontinence and fecal incontinence, stool, poops, those are hand in hand. When we talk about that BCR, that bulbocavenosa reflex nerve, it's pee, poop, and sex. Those are the three things that are tied to that. And that's why that questionnaire gets into that conversation. And then finally, it talks a little bit about sexual dysfunction and those kind of things. And that's our basic questionnaire. So you see
And
how that would be beneficial.
And that's the one thing is, I mean, I know with my own provider, and I love my provider, nothing wrong with my provider, but I don't remember ever having a conversation about it. I maybe was asked one question about it, maybe on a questionnaire for my annual, and I can't even remember if I was. So I think this will be very enlightening and very helpful for other women out there. And I really appreciate your time and insight on this. And if you have any further questions, please again contact your provider. And if you are a provider out there, we can provide you a list of these questions if you are questions that you would like to ask for your patients. If you have any other questions, again, reach out to us via the link that's in the discussion notes. And I want to thank you for watching. Thank you again, Dr. Mike.
It was a pleasure.
Any last words or any final three thoughts?
I think the final thought I would give is that, just because your medical professional doesn't ask these questions doesn't mean they don't care about it, but it's up to you as a patient to be your own best advocate. And medical professionals, if you want to reach out to us, please do. I think we can really help you come up with a protocol that might help patients who have this issue. So across the board, let's all help each other.
Great. Thank you. And thank you, everybody out there.